Hello, welcome to the Foundation Health Partners online total joint class. My name is Jennifer Osnes. I'm the director of the rehab department here at the hospital. In this class, we will be joined by my colleagues from the surgery department, physical therapy, occupational therapy, and the 3 West nursing floor. We are hoping to help you feel better prepared for your upcoming surgery, to know what to expect, what things that you can do to help get yourself prepared at home, and to hopefully answer all of the questions that you have regarding your upcoming procedure. In today's class, we're going to be going over several different things. We're going to be reviewing our special COVID-19 precautions. We are going to go over our pre-hospitalization and surgical process, our nursing services that you will encounter, and our rehabilitation services. At Foundation Health Partners, the health and safety of our patients is our top priority. We are diligently monitoring updates to COVID-19. We understand how challenging this is for everyone, but we want to reassure you that we're committed to using evidence-based preventative measures to ensure the best outcomes. Things that you should know while you are at FMH for your surgery. We will be having pre-surgical testing requirements in place as per state mandates. Prior to your surgery, please avoid contact with others or leaving your home as much as possible prior to surgery. We want you to be as healthy as you can be before your procedure. Please follow physical distancing and hand washing guidelines. Be sure to check for any COVID-19 symptoms daily prior to your surgery. Please notify us if you are concerned. All patients and visitors will be screened upon entrance to the hospital, and the use of surgical masks are required for everyone over the age of 2. Please be aware that the hospital has defined visitation restriction levels dependent on circumstances in the community. As we all know, the infection rates for COVID-19 can be fluid and vary from day to day, and our restriction levels will reflect that at the hospital. You will see signage with numbers 1 through 5 to indicate which visitation level that we are at when you have your procedure. For the most current visitation information, you can visit our website, www.foundationhealth.org, and look for the COVID-19 information tab to find more information on our visitor restriction levels. Joining us next will be Linda and Cheryl from our pre-surgery admissions testing department.
Hello, my name is Linda. I'm one of the pre-op nurses here at Fairbanks Memorial Hospital. I am one of the pre-admission or pre-surgery nurses that you'll be speaking with prior to your procedure. Today we're just going to go over our pre-hospitalization and surgical process for you. We'll go over pre-admission testing, pre-surgery do's and don'ts, where to go day of the surgery, what to bring and of course what not to bring, pre-op and operative procedures, and of course post-op recovery. So our pre-admission testing. Pre-op registration will contact you to make an appointment to register for your surgery and a time for you to actually speak with one of the pre-surgery nurses, either myself or one of my coworkers. This will include either an in-person visit where you come to the hospital or a telephonic interview with, again, one of the pre-surgery nurses. You may be required at some point to bring your personal ID and your insurance card to the hospital prior to your procedure. Please have a complete medication and allergy list available when we start the interview. Now, during this pre-admission interview, we will talk about your medical and surgical history. We will provide you with education, information regarding the day of the surgery. This appointment is located, if you're coming in, on the first floor of the north entrance surgery tower. And again, you may be here for the visit and actually meet face-to-face with one of us, or it can be totally over the phone, whatever is the most convenient or what your doctor has ordered. First of all, let's talk about surgery do's. Do notify your surgeon if you become sick, develop a fever or cold, or you've got some type of other infection prior to your surgery. Some patients will be asked to use our chlorhexidine soap wash, and we will provide that to you. You can use that the night before or the morning of, and we will provide that education for you. Make sure that you hydrate before your surgery day. Plenty of fluids until 2 hours prior to your arrival at the hospital day of your surgery. Do take your medications that the pre-admission nurse has talked to you about. Some medications we want you to take. There will be others that we would like for you to hold as per your doctor's orders. Now, some people will need to bring their equipment with them to the hospital. If we have asked you to do so, please make arrangements to have that equipment here at the hospital when you arrive. Now, some of the other surgery do nots, please don't put any deodorant or lotion, face cream, makeup, or any other nail polish on your person prior to the surgery. Men can shave their face, but please don't shave any other body part, including the operative site. Please don't use any nicotine after midnight, and that includes marijuana. Smoking and vaping certainly irritate your lungs, and we don't want that before your surgery. Please don't eat after midnight. This includes chewing gum, mints, and lozenges. The day before surgery, or if your surgery is scheduled for a Monday, it would be the Friday before your surgery. Please call outpatient surgery between 2 and 4 for your surgery time. You will speak with a nurse who will tell you what time to be here and what time your surgery will start. And that number is 907-458-5690. You will be coming to the north entrance of the hospital. That is our new surgery tower. Please follow the signs as you're pulling into the first driveway of the hospital. Make sure when you come for your procedure that you bring your eyeglasses with an eyeglass case, dentures, your hearing aids, and a rescue inhaler if you use one. Please bring hygiene products, toothbrush, toothpaste, hairbrush, comb, and feminine products if you need. Personal items to include your cell phone and a charger if desired. And make sure you're wearing comfortable clothes, easy on, easy off. You may be doing physical therapy here at the hospital, and it's always nice to have comfortable shoes and comfortable clothes on. Please do not bring jewelry, body piercings, your iPad, laptop, cash, credit cards, and or keys. If you're having any prescriptions filled here at Denali Pharmacy, you may need to have a small amount of cash for a copay or a credit card to pay for any of these items. And if you do bring any valuables, they will probably be kept with security, or we may ask you to give those to your loved ones to take home for safekeeping. And up next is one of our pre-admission nurses, and her name is Cheryl, and she'll go over a little more information about your day of surgery.
Hi, I'm Cheryl, and I'm one of the pre-surgery nurses, and I'm going to talk to you about your surgical experience while you're here. On the day of your surgery, you're going to come to the north entrance of the hospital, and that's easily found watching for the big blue signs and the pretty aurora lights on the side of the building. Once you come in, they'll check you in at the guest services desk, and then we'll direct you to the elevator up to the second floor. Up there, the pre-op nurse is going to come greet you. They're going to put an ID band on you that's going to stay on your arm for the entire time you're in the hospital. They're going to weigh you and measure you and show you to one of the pre-op rooms. They're going to give you some antibacterial wipes to wipe your skin with, and then have you change into a hospital gown. Once that's done, they're going to check your blood pressure, your heart rate. If you're diabetic, they're going to check your blood sugar level, and they're going to start an IV on you. They're going to ask you a million questions to include your name and date of birth, and expect that you're going to be asked that a lot during your hospital stay. That nurse is going to go over your home medications and hook you up to monitors. and just have everything ready for the surgeons. The surgeon's going to come in and talk to you, and that's a good time to ask any last-minute questions. The surgeon, while he's in the room, also needs to initial the correct body part. They will use a pen and put their initials, so there's no confusion about where we're doing the surgery. And you'll also talk to the anesthesiologist. They're going to come in and talk to you about how they're going to keep you comfortable during the surgery. And if your surgeon ordered a nerve block, they're going to talk to you about that. And they may do a nerve block in the pre-op room, or it may be done in the surgical area. But they will discuss that with you, and you'll be comfortable with that. Your friend, your family, or your support person, whoever's with you, can stay with you throughout the pre-op process until it's time for you to go to the OR. Once the OR is ready, they will come and get you and take you by stretcher into the operating room. Your family will be escorted to the waiting room. They'll be given a little slip of paper with a number that corresponds with you. And there's an electronic board in the waiting area, and that tells them where you are in the process. Once you get into the OR, there's going to be last-minute introductions of everybody who's in there, double-checking everything, confirming everything. They're going to position you onto the operating room bed, hook you up to all kinds of monitors, and get you all comfy and ready for surgery. And then anesthesia will take you off to sleep. Next thing you know, you will be looking around thinking, I'm not in the same place anymore. You'll be in recovery. Once your surgery's done, you'll be taken to the recovery area for anywhere from 30 minutes to an hour. The nurses are going to be managing your pain. We use a scale of 0 to 10 for pain, and we want your pain under control. It's important while you're recovering that your pain's controlled well enough so that you can do the things that are necessary to recover. They're also going to make sure that you're warm and comfortable, and they also want to prevent nausea. If you feel the least bit nauseous, let the nurse know as soon as possible so we can help treat that. Now, you are going to have pain after surgery. That's to be expected, but our big focus is managing your pain afterwards. Your surgeon's going to update your family, let them know how things went, and they'll come and see you again. Now, that visit might be a little fuzzy in your memory, but he'll talk to you again before you're discharged from the hospital. And then you're going to be transferred over to 3 West. So at this point, I will turn this over to them for the next portion of the class.
Hi, my name's Anna. I'm a nurse on 3 West, and today I'm going to be discussing what to expect following your surgery, what are our patient care boards in your room, what to understand with the post-operative nursing priorities that we will be doing with you, and I'm going to introduce you to the healthcare team. So when you immediately come out of the operating room, you will be in the recovery room called PACU. That time you will spend in PACU may vary from 30 minutes to an hour and a half. Once you are ready, you will be transferred to the post-op unit, which is 3 West, which is with us. When you first come to the unit, we will give you welcome information. We'll do frequent vital signs on you. We take them very frequently within the first few hours after surgery and closely monitor you during the recovery time, so you won't get much sleep time. Pain management. Your pain management regimen is determined by your doctor. You may have several different medications ordered to manage your pain. These medications may be scheduled and PRN, which means as needed, so you have to request them. The nurses, so me and your doctor, will work with you to find what medication works best for your pain. Surgery is painful, and it is normal to experience pain. We also incorporate non-pharmacological methods to help reduce pain, such as ice, elevation, and rest. The goal is to treat your pain so that it is at a manageable level to enable you to participate with PT and mobilize. An example of a medication that you may be on, depending on who your surgeon is a Pca pump. You are connected to this through your IV, which is in your extremity. And anytime you have pain, if you can't breathe through it with a non-pharmacological method, you push this button and you are delivered narcotics. We try to wean you off of this as quickly as possible because it inhibits you from going home. We got to get you on the oral pain meds instead. Next, we do assessments of every extremity and body systems. We will frequently do this 2 times a shift on day shift, 2 times a shift on night shift. We do brain to lungs to heart to bowels to urinary, and then of course your affected limb we will assess very frequently as well. We ask questions about how things are feeling and moving. We check in with your mentation, circulation, and movement. So whenever something feels off, we want to know, and then we will relay that to your doctor. IV fluids will be initiated when you're on the floor just to help with hydration. The length of time you're connected to IV fluids is determined by your doctor, and of course how much you're taking in orally. Let's see here. Oxygen. Sometimes you'll come up on oxygen, which is totally normal. Sometimes you just need the little boost after anesthesia. So nothing to be alarmed about on that regard. Assisting with ADLs, which is activities of daily living. So we will help you with toileting, with bathing, everything you need. Patient care boards. So they are boards in your room that have sections so we can write notes on for you, for us, for the doctors. It has references like how many times we've checked on you, even if you're sleeping. Pain level references, and contact information. Even though it's in the chart, it's sometimes helpful to have it on the board too. And we can write, like I said, anything we want on it. Post-operative nursing care priorities. So blood clot prevention. That is super important after surgery, especially joint surgery. They can increase your risk for blood clots. Often some sort of blood thinner is ordered by your doctor, which is either a oral medication or an injection. Other ways to prevent blood clots is moving, so ambulating, wearing compression stockings, and or wearing, they're called SCDs, which are leg squeezers to massage your legs. And the purpose of these is to help direct the flow from your lower extremities up to your core to prevent swelling and edema. Pain control medication is often ordered scheduled, so it comes automatically, and or PRN as needed, which you request for. Fall prevention is huge in the hospital, so we will ask you to call us before you get out of bed, just to have someone in the room in case you lose balance or get dizzy, which is very normal as well. Deep breathing. So you use physical therapy for your new joint. A incentive spirometer is physical therapy for your lungs. So with this machine, you actually inhale, deep inhale, and it helps prevent pneumonia. It helps re-expand your lungs, so it's super important after surgery. So you'll be doing that hourly while awake. And like I said, resuming daily activities such as toileting, dressing, which may be hard sometimes after new joints, bathing, and toileting. Your healthcare team, we are color coordinated. So nurses are in this maroon color, as you see. Nursing assistants are in gray. The operating room staff, which you may or may not remember, is in light blue. Rehab is in also another color, light blue. Respiratory is in green. Lab is like an olive. Environmental services, our cleaning staff is in a navy blue. And radiology is in black. So I am going to pass this over to the rehab department now. Thank you.
Hi, my name is Kira Baird. I'm a physical therapist here at the hospital.
And I'm Allison Hubert. I'm an occupational therapist.
So the physical therapy team at the hospital is made up of physical therapists as well as physical therapy assistants. Our primary goal is to ensure that you can safely return to and function in your home. This will include addressing bed mobility, transfers, walking with an assistive device, and practicing stairs if needed. We will also address the strength and range of motion around your new joint.
And as occupational therapists, our main focus is to help you resume your activities of daily living. We work on dressing, bathing, toileting, transfers in and out of, or often on the commode, and shower. We provide education for home safety, use of adaptive devices, and or bathroom equipment. Now, before hospitalization, there are some things that you could do to prepare your home. Things such as making sure that you remove throw rugs, ensuring that the chairs that you will be sitting in do not have wheels or swivels, tucking in the bedding corners of your bed, installing night lights as we're getting more into our winter season, clearing the pathways around your bed and bathroom, removing any safety hazards, and making sure the things that you need are within easy reach. We also want you to obtain the necessary equipment for being able to do things for yourself more easily and arrange for any help at home if you might need it. Pre-cooking and freezing food ahead of time is always a good idea, and making sure that you have walker trays if you need it, as far as being by yourself at home to get things safely to and from your kitchen counters to a safe seating area. As you prepare for surgery, also keep in mind that exercising, including walking daily before your surgery, will help speed up your recovery. Motion is lotion, so we want you to move to feel better. Make sure as you pack for your trip here to the hospital that you have nice loose-fitting clothing such as athletic shorts and t-shirts, and shoes with good support are helpful that have closed heel areas.
Exercise after surgery has numerous benefits to include restoring normal range of motion, increasing strength in the muscles surrounding your new joint to provide support to that joint, and decreasing recovery time by increasing blood flow to the surgical site and reducing pain and swelling in the area. Exercise in the first 3 weeks after a total joint replacement is critical in speeding your recovery and allowing you to return to the activities you love to do. You will be provided with an exercise handout that we will expect you to become familiar with and begin performing independently. While in the hospital, our goal will be to see you 1 to 3 times a day between both PT and OT. Our visits will focus on functional activities to increase your mobility and safety. While pain cannot be completely avoided, we will work closely with your nurse to try to schedule our visits after you receive pain medicine. We also have ice packs available that can be useful in decreasing pain and swelling following PT and OT visits. Prior to discharge, we expect all of our patients to be able to get in and out of bed independently, walk approximately 150 feet with a walker or other appropriate assistive device, navigate the number of stairs you will need to navigate at home, and be independent with your home exercise program. For patients having their knees replaced, we hope to have you bending your knee at least 90 degrees. For patients having their hips replaced, we will expect you to be able to verbalize and follow all of your hip precautions. Speaking of hip precautions, let's talk about the different hip precautions. If you are having your knee replaced, you can ignore the information in this slide and the next one. For those of you having your hips replaced, this information will be very important. The precautions you will have after your surgery will depend on which approach your surgeon performs during surgery. With the posterior approach, you will not be able to bend your surgical hip past 90 degrees, rotate your surgical leg inward like pigeon toes, or cross your legs. You will need to be aware of these movements while in bed, sitting up, and standing with your surgical leg planted. With the anterior approach, you will not be able to cross your legs, rotate your leg outward, or extend your hip backward. Again, the specific precautions you receive will depend on your surgeon and will be taught to you multiple times after your surgery.
Now let's talk about equipment. These are the things that you may need at home to help make life a little bit easier. We have options such as front-wheeled walkers to make it safe for you to mobilize, tub transfer benches or shower chairs for you to have a seat while you're in the shower bathing, elevated toilet seats or bedside commodes, as well as toilet safety frames. There's multiple options for bathroom use at home depending upon what your bathroom setup is like, which we go into detail and discussion while you're here during your hospital stay. Other items of adaptive equipment that are helpful for things like lower body dressing include this slide, which is reachers, sock aids, long-handled shoe horns and bath brushes, dressing sticks, and elastic shoelaces. This specific equipment is important for those having total hip replacements because we do not want you breaking your posterior hip precautions by bending forward to reach your feet. That's why we will go through each item individually and provide you a hip kit of each of these items for you to practice and take home with you at discharge. Now, where would we obtain this equipment? When you come to the hospital and you have a total hip replacement, we can provide you with the total hip kit. If you choose to obtain some of the bathroom equipment prior to coming to the hospital, you can look into places such as Access Alaska for loan equipment or medical supply companies in town such as ProCare. Other stores in town such as Lowe's, Home Depot, Walmart, Walgreens, Fred Meyer's, and Safeway have pharmacy sections that do have some of these items available for purchase as well. As far as insurance and equipment, unfortunately, Medicare does not cover bathroom equipment. So most of that must be purchased on your own, which is why we recommend either a loan closet or if you have something already, to utilize what you have. But you are able to check with your insurance company prior to surgery to determine if they will cover or not cover any specific equipment that can be ordered or obtained ahead of time. Insurance companies such as VA, Medicare, Medicaid, Chief Andrew Isaac, or private insurances all tend to be different, so it's important to check ahead of time to make sure that you know what is expected of you as far as obtaining equipment.
Switching gears a little bit, here's a quick video explaining and demonstrating the proper way to get in and out of a vehicle after a total joint replacement.
Hi there, my name is Rachel and I'm a physical therapist here at the hospital, and I'm here today to demonstrate how to safely get in and out of a vehicle after you've had a total hip replacement and therefore need to follow those hip precautions. Firstly, when you come to the car, there's a few things you want to make sure you adjust prior to getting in, and that is the seat. So make sure that the seat is actually pulled back as far as you can to allow space for you to transfer in, as well as make sure the seat is reclined back to allow you to get in without breaking that hip precaution. So I will demonstrate. Using your walker, you're going to back up to the vehicle, okay, as close as you can until you feel your legs touch the back. From here, we highly recommend that you do not hold the door, as it can move and may fall back on you and causing a fall. So we recommend that you reach back and hold either the dash, okay, or the door jamb, but just be careful that this door does not shut. So this is a good spot if you have someone with you to hold the door to ensure that it does not move during this transfer. So one hand on the dash, the other hand can reach back, okay, and hold the edge of the seat. So I'm going to demonstrate this video as if my right hip just was replaced. So I'm going to first bring that right foot forward, okay, with my hands propped, slowly sit back so I can get to the edge of the seat, so I keep that angle or that 90 degree at my hip. From here, you can scoot back into the car as far as you can, leaning backwards. From here, you then can slowly transfer and twist your body to get that leg in. Then to get the leg out, I'm going to reverse, making sure I'm leaning back to not break that hip precaution. I can then hang on to the handle here, I can hang on to my dash and slide my hip out to where it touches, and then carefully lean forward, again, making sure not to break that hip precaution. So while I transferred in, transferred out, be careful as well not to bring that leg across your midline or have your legs crossed at any point. Once you're here, you can bring the walker close to you, and again, either have your hand on something stable, so the dash and the seat, not on the door, okay? Or you can have one hand on the walker as long as one hand is on that stable surface. With my leg kicked out, gently lean forward and stand up. Again, not breaking that hip precaution. If you had a knee replacement, we recommend that you follow this same maneuver. As well, we realize that you do not have hip precautions. By getting in and out of the vehicle, by backing up in this manner, will make your transfer much easier and safer.
And then now we'll have a video on tub transfers for when you are cleared to shower, to give us more specific instruction of how to transition over the side of a tub.
So if you have a shower stall, this is going to be the easiest way to get in and out to bathe. There's a couple different ways that you can do this. If you have if your threshold is flush, that's obviously not going to be an issue for you. But however, if you do have a little lip on the bottom of your threshold like this one, I'm going to show you how you're going to safely step in and out. The one way that you can do it is back up until the heels touch on the outside of that ledge. And you're going to step back with your non-affected leg first. So if I had surgery on my left leg, I'm going to step back with this right leg and then bring your operated leg in last. And if you have grab bars, you can hold on to those. If you have enough room inside your walker, and if your balance is good enough, you can bring that walker inside with you, so that way you can turn to take a shower with the walker. The only thing is you're going to have to be able to dry it off when you get out. And then to come out, if you have the walker, you're going to bring that walker out. Or if you're just leaving the walker on the outside, you're going to leave that walker on the outside of the shower. And now this time you're going to step out with your operated leg first, and then step out with your unaffected leg last. So the second way to get into your shower, if you don't feel comfortable going backwards, is to sidestep in and out of the shower. So what you're going to do is you're going to come alongside the edge of your outside edge of your shower and then angle up your walker if you can. Sometimes you may need to straddle it over a toilet that might be here. And what you're going to do is we're going to sidestep in. So one thing I want you to keep in mind is if you've had a total hip replacement, you want to make sure that you are not bending your knee higher than your hip level or turning your toes in. So one safe way to do this when you're stepping in, so I'm going to have you put your hand on the wall, or you can use a grab bar if you have a grab bar in that area. One hand on the walker. So I'm going to step in with my unaffected leg first, and then I'm going to bend at my knee and bring my operated leg in. And then you can, if you've got enough balance, you can sidestep over and take your shower. Or if you don't feel like your balance is good enough after you've had a hip or a knee replacement, you can always get an adjustable height shower chair to sit down on. Now to come back out, you're going to just do everything in reverse. So you're going to sidestep over. So say this is my right side. So I'm going to bend at my knee. I'm going to bring that leg out. Make sure I have enough room to bring my left foot out onto the floor. And I'm going to step out. So if you don't have a shower stall at home and all you have is a tub shower combination, and or if you live alone and your balance is not good, I recommend that you get this type of piece of equipment, which is called a tub transfer bench, where as you can see, 2 legs sit on the outside and 2 legs sit on the inside. And I'm going to demonstrate how to do this. Now I want you to keep in mind that you will have hip precautions. So again, you want to mind those 3 big precautions: no crossing your legs, no turning your operated toes in, and no bending past 90 degrees or bringing your knee up higher than your hip. So what you're going to do, you're going to face the tub bench so it's facing your faucet that's coming out. And you're going to walk up, you're going to turn around. So for purposes of demonstration, I'm going to show you as if I've had a right total hip replacement. You're going to bring your operated leg out first. You're going to reach back with one hand, and you're going to slowly sit down, sliding your right leg forward. And now what you're going to do is you're going to make small little pivots over, minding your hip precautions. So now when you're getting your legs in, with your unaffected leg, you can lift that however you want to get it up and over the edge of the tub. However, now when you get your operated leg in, you just want to make sure that you're not going to bring that knee up higher than your hip. So what you may need to do, if you feel like your knee is going to come up higher than your hip, is lean back a little bit just to clear that leg, all while you're scooting over. and then you're inside the tub, and you can use a handheld shower hose, and you might need to use a long-handled sponge to get down to your feet. So to come out, you're going to just do everything in reverse. You're going to, again, you may need to lean back, lift that leg up, make sure you keep the angle of your hip open. You're going to come out, you're going to bring your unaffected leg out, and you're going to make small steps around. You're going to come to the square, come to the edge. You're going to put your operated leg out in front of you, one hand on the walker, one hand behind you, and slowly come up. So if you are able to step over the edge of your tub after you've had a total knee or total hip replacement, you can use, if you feel like your balance still is not good enough to stand in the shower to shower, you can get an adjustable height shower chair like this. They come with the backs and without the backs, and most of the backs are removable. And one way to come in here is if you're going to step in, you're going to want to sidestep. So if you need to, you can put one hand on your device, your assistive device that you have, one hand on the wall, or if you have grab bars, you can put your hand on the grab bar. And what you're going to do is, so again, I'm going to demonstrate this with right total hip. You're going to step in with your unaffected leg first. You're going to bring your right leg out, your operated leg out to the edge of the tub. Make sure your left foot has enough clearance to bring your right foot in. And again, you're going to want to make sure you don't bring your knee up higher than your hip. So one way to do that is bend back. If you are on the short side like myself, you may need to come up on your unaffected leg, on your toes of your unaffected leg to bring that leg in. And then you can come over, you can bring that right leg out, you can reach back and have a seat. And then to come back out, you stand back up, put hands on the wall or on the grab bar if you have them. Again, you're going to bend at that knee, come up on your toes if you need to clear to come out. Bring that left leg closer to the inside of the tub, and then bring your unaffected leg out.
Now let's take a look at home safety. One of the things that is very important to us is to make sure that not just that you move well, but also that you are safe once you are discharged to home. So make sure that if you have a portable phone or your cell phone, keep that within reach at all times. Use your reacher if you need to pick up items off the floor. Use your assistive devices at all times. That means your walker until you get cleared by physical therapy in outpatient to progress that assistive device. Continue following all of your precautions until you're cleared by your surgeon. And if you do have pets, be aware because they are very excited to see you and they can be a tripping hazard.
Continuing your therapy after you leave the hospital will be important to continue making progress with your strength, range of motion, and functional mobility. Recommendations about continued rehab after discharge will be made during your hospital stay and may depend on your surgeon. If you need help coordinating your care after discharge, we can have a case manager or social worker visit you during your stay. Now here's a list of frequently asked questions regarding physical therapy and occupational therapy specifically. The first one, I just got out of surgery, do I have to participate in therapy already? The answer is absolutely yes. Depending on the time of your surgery and when you arrive to the nursing floor, PT will see you either that afternoon or the morning after your surgery. Whether PT sees you the day of surgery or not, you can expect to at least sit up at the edge of the bed with nursing staff the day of surgery. The next question, am I going to damage my new joint? No. If you have any specific weight-bearing restrictions, those will be taught to you after you wake up from surgery. Otherwise, as long as you are following your precautions, getting up and out of bed will not damage your new joint. Is therapy painful? As we've discussed in great detail, it's unrealistic to expect to be completely pain-free. However, we will work closely with your nurse to try to keep you as comfortable as possible. And lastly, when will I be discharged from the hospital? Although this is ultimately up to your surgeon, it will also depend on your functional mobility while you're in the hospital and meeting all of your physical therapy and/or occupational therapy goals. In closing, it's important to remember that you are your own best ally when it comes to rehab. You control your outcomes with the amount you participate and comply with therapy. While in the hospital and once you return home, do not spend too much time in bed. And while you're here, do not refuse therapy sessions. As a final reminder, please remember to avoid driving after discharge until cleared to do so by your surgeon.
Well, that concludes our presentation today. Thank you for watching our total joint class online. We hope you feel better prepared for your upcoming procedure. If you find yourself still having questions after watching, please feel free to reach out to us on the email address located at the bottom of the screen. We look forward to seeing you soon and have a great rest of your day.